So, Dr. Nicole here. Today, I want to talk to you guys about Sculptra. That's this stuff right here. Sculptra is PLLA, which is basically surgical threads that have been ground up into a powder. It arrives in a powder form, and what we do is we put some saline and lidocaine in it, and it becomes a liquid form. The best use of Sculptra is to treat these cheek lines. So when we smile and we age, we lose volume in the cheek. People think of aging as, oh, my skin is sagging. But why is the skin sagging? It's a lack of volume underneath the skin. We lose fat and bone mass underneath the skin. So what the Sculptra does, it actually stimulates the body's processes to produce more collagen under the skin, thereby treating these cheek lines when we smile. Sculptra is really best used in this area. We call it the submalar hollows. This is when, people are thin, or as we age, we kind of get this sunken in appearance underneath our cheek. And in fact, people will go for cheek fillers, and they'll kind of ignore the submalar hollow. The other area that gets frequently ignored are the temples. So Sculptra is great for the temples and the submalar hollow to keep that face in that beautiful heart shape. The one thing you have to remember with Sculptra is that after it is injected, you have to massage the area 5 times a day for 5 minutes for 5 days. Sculptra should not be used in the donut muscles that we have in our face. Those are around the eye, the squinting muscles or periorbital muscle, and the perioral muscle. This is another donut muscle area. These are the 2 areas where we should avoid Sculptra. Sometimes it can lead to nodules. People who are susceptible to developing keloids should not use Sculptra. I'd like to show you some examples of a Sculptra treatment. We typically do 1 treatment every month for a total of 3 treatments. The final results are going to be 3 months after your last treatment. So you got to be ready for the long haul. I want to show you some examples of our actual patients in progress. So this is 1 month after her 2nd round of Sculptra. Remember, it takes 3 months after your 3rd round to see the peak of the results. But you can see progress-wise, she's got improvement in that submalar hollowing area. This is the same patient from a 45-degree view, and you can really see the improvement in that shadowing underneath her cheek. This is a different patient 2 weeks after her 2nd round of Sculptra, and you can really see how Sculptra does a great job at targeting those cheek lines when we smile. This is that same patient in a 45-degree view. While she's smiling, you can really see the improvement in her cheek line. This is my personal before and after. So this is 1 month after my 4th round of Sculptra. And you can see I have a lot of hollowing on the right side of my face, especially more than my left. And you can see the dramatic improvement from that.